Hello and welcome to the Girls Fuel podcast. My name is Haley. I'm a registered dietitian and nutrition coach here to help you along your health and fitness journey by providing evidence and experience-based knowledge, and as always, full transparency. Jess is here with me today, and we have a pretty important episode for you. We are going to talk about how we can tell that you might have a GI issue based on your basic blood work, the blood work that your doctor probably runs for you every year if you make that annual appointment with a PCP. So we're going to dive into what we're looking for when assessing GI function. Big pillars are going to be, we're looking at nutrient absorption. We're looking for nutrient deficiencies. We're looking for signs of inflammation, immune deficiencies, or heightened immune responses. So we'll dive into what panels are important. And Jess, do you want to just give us a quick summary of what the panels will be going through and like what ones doctors typically order?
Yeah. So typically, you're always going to have a CMP and a CBC on your blood work. And so CMP is just basically protein digestion and shows organ function. But then the CBC is all the information about red blood cells, white blood cells, and things like that. So those are common ones that are often run. The other ones that doctors usually run is liver. So they usually do an ALT and AST. And the less common ones, I find there's at least a couple markers on most blood tests, but lipids. So usually there's total cholesterol, LDL, and HDL. Sometimes they miss a couple, but usually those are on there. And then iron. So serum iron and ferritin are the main ones there.
Yeah, definitely. And sometimes we'll see a couple thyroid markers on stuff we see from doctors' offices, which can also tell us what's going on, because we have to remember the gut is literally the center of everything. So if something is off in the gut, other organ systems are going to be impacted. But today we're going to stick to talking about the basics. So the first one is that CMP, the complete metabolic panel, which really does evaluate overall health and especially health of the liver and kidneys. So this is a super important panel. I think a lot of people overlook this one with how much it can tell us. So CMP, that'll show things like glucose and BUN and creatinine. The biggest thing we're looking for here, like Jess mentioned earlier, is protein digestion, specifically related to how are stomach acid levels? How is hydration? Are you adequately absorbing, breaking down your protein? Is there oxidative stress in the body? How are your liver enzymes, all of that? So a lot of times when I'm looking at the CMP, I am especially looking at the following markers to assess for hypochlorhydria, also known as low stomach acid. We've talked about this in tons of other episodes, but low stomach acid levels, it's one of the bigger root causes of digestive and immune system issues, because stomach acid not only plays a major role in breaking down our food, but it's also a main part of our immune function. Stomach acid is what neutralizes things before they go to the intestines and cause. So we need that to keep viruses, bacterial overgrowth, and everything at bay. So when we see certain markers, like for example, a high BUN, blood urine nitrogen, that could show us that low stomach acid is present, maybe dysbiosis as well. And then obviously we know BUN is a kidney function marker, so that could show either dehydration or also issues with kidney disease or just kidney insufficiency, right? And then on the other side of the spectrum, if we were to see BUN low, which is also really common, I would say low BUN is much more common. We
Yeah.
might suspect that you're not taking in a lot of protein, or you're just not absorbing it. So either way, when BUN is off, we're seeing an issue with protein digestion, with malabsorption, and likely some sort of pancreatic insufficiency. So we're not getting the enzymes that we need in order to break down our food. So that, again, just that one marker, like it just told us so much about what's going on in our body. We also get a good look at our electrolytes, so sodium, potassium, and chloride. These obviously will show signs of dehydration, but they'll also show signs of fluid loss. So if somebody is having significant amounts of diarrhea, they might pop irregular for any of these electrolytes. And chloride is also an essential part of stomach acid. Stands for hydrochloric acid. So Fluoride, right? So when we see low levels of fluoride in the CMP, less than about 100 millimoles per liter, that could show that we do have that hypochlorhydria present, that low stomach acid. Other ones are elevated CO2. That's another big one that I'll see where CO2 is usually above 28 to 30. That would be that it's high. We also see issues with absorption of vitamin and minerals, specifically in the CMP. We're looking at that calcium level, right? So calcium is a very important mineral that is also very tightly regulated by the kidneys. So when we see low levels of calcium, that could be related to hypochlorhydria because stomach acid is needed in order to properly absorb our calcium. Other ones, maybe look, I don't think they test for phosphorus that often. Sometimes I'll throw it on. I don't, that's not in a basic CMP though, in my opinion.
No, yeah, I've gotten it thrown on too, but
Yeah. So if we
only,
see, because
yeah.
that phosphorus is another big one in addition to calcium that is great to look at for kidney function, but phosphorus is also like a main mineral in bone and teeth health, as well as like it's important for muscle contraction. So I'll throw it on there, especially if I suspect like parathyroid or kidney issues. But when we see low levels of phosphorus, that can also be hypochlorhydria. The next few are always on the CMP, and probably the first ones that I look at: protein total and albumin. So these are also related to just proteins that are in the blood, right? So like our total protein is like just the sum of all albumin and globulin proteins in the blood. So when we see that low protein, that shows us that we might have an issue with hypochlorhydria, or you're just maybe not including enough protein in your diet. But more often than not, it's poor protein breakdown. Or this one's interesting, Jess. I don't think we've talked about this one yet, but sometimes when we see low total protein, it could be a sign that there are more amino acids needed by the body. And in my mold
Mm.
test, I saw that all my amino acids were like freaking zero, which I suspected that I had hypochlorhydria, but we'll get to that, what symptoms of this might look like so that you know what to look for, because labs vary day to day. And I really want to drive this home. So if we get a client that like all their labs are like, oh my God, you have hypochlorhydria or you have this deficiency, but they literally feel fine, we're not going to go crazy and add a billion supplements. We might make some minor tweaks, but the labs are just one tool. So even like when we're doing a client intake, I personally look at the intake and the symptoms before the labs. The labs are like the
Oh
last
yeah.
thing. They're not like, they're important, they're helpful, but we don't need them. So just because you have minor discrepancies in your labs, and that's honestly why we're not really going into what the actual ranges we're looking at are, because it does vary day to day. But these are just like trends we can look at, especially when we get to the CBC, like the white blood cells. Some of my clients, I have years worth of data, and it's really cool seeing like improvements in those markers. But for the low stomach acid and absorption of protein, total protein, albumin, and globulin are the biggest ones that we're looking at. When it comes to looking at bile health, so thinking gallbladder, liver, I'm looking at bilirubin. If we see high levels of bilirubin, then that could mean that we're having a bile tract issue and or liver dysfunction. And that can show up in our stool by showing hard stool if you don't have enough bile, by showing mucus in the stool, and so on and so forth. As far as low stomach acid, Jess, you want to give a gist of symptoms for that?
Yeah, so I find that low stomach acid, it's either a lot of bloating and like stomach aches and stuff, but the opposite. So some people think they have high stomach acid because they have acid reflux, but it's actually low stomach acid. Yeah, so bloating, gas. Some other ones are like you might feel like there's, especially after eating or like a couple hours later, you'll find like a lot of indigestion. I think that's a really big one as well.
Food in the stool is another one. Because
Food in
usually
the
when you have
stool,
low
yes.
stomach acid is the first step to digestion, right? So the food, it enters your mouth, and when you chew, salivary amylase is secreted. Salivary amylase doesn't really make a dent, right? It might start denaturing and whatever the word is for breaking down carbohydrates and starches, but true digestion starts in the stomach. That is the first digestive juice that really makes a dent, and that is stomach acid, right? That is what we've been talking about, that breaks down protein, and that's also where it'll get mixed in with other gastric juices as it enters the intestines and So we need the stomach acid, we need the bile, we need all of those amylases and lipases in order to break down our food. So if we're not breaking it down, that's where we see a lot of issues. And then it also opens us up for an increased infection, increased likely of getting an infection. So other things in the CMP, the AST, the ALT, those liver enzymes are in the CMP the majority of the time. So those are not only showing us how our liver function is, but it's also showing us how we're utilizing our vitamins, especially our B vitamins. So with the ALT and AST, if we see them high, that usually is dysfunction in the liver, maybe fatty liver, cirrhosis. If it's extreme, we don't usually see cirrhosis in our practice. But when I was interning in the hospital, I saw a lot of that. It was like liver enzymes that were freaking 400 and stuff. And yeah, I remember the
Whoa.
first time I saw that, I was like, oh my God, like they're dying. And the other dietitian was like, what do you mean? Like they have cirrhosis. And I was like, yeah, we need to do something about this. And they're like, they just have cirrhosis. And I'm like, what? So anyway, liver issues, liver congestion are big ones with that. We might also see elevated liver enzymes with celiac disease. There are actually a lot of things in your lab work that can point to celiac. Low stomach acid is one of them, but so are liver issues and vitamin and mineral deficiencies, which is when we get into the CMP, which is your complete blood count. And this is honestly my favorite panel. And we've talked about this before, Jess. Blood work is my favorite kind of test. Like I love the GI map, but I fucking love reading blood work. It just tells us so much about you as a person, like your history, what's going on in the present, like all different organ systems. So the CMP, it really does help us see a big picture of your health, but especially like your immune health. It's helping us detect a variety of disorders, including anemia, infections, and other stressors in the body. So Jess mentioned earlier, the big features here are going to be our red blood cells and our white blood cells. So red blood cells are going to be really important because they carry oxygen from our lungs to the rest of our body, and they also help carry carbon dioxide out and away from the cells in our body. So when we see low levels of these red blood cells, that is almost always going to mean some sort of deficiency, be that iron, B12, folate, maybe even copper, or that there are increased vitamin C needs due to depressed immune function. But the first thing that comes up on the CBC is that white blood cell or W. And this is just the total count of our white blood cells, of the blood cells that we see down the panel. So the neutrophils, the lymphocytes, the basophils that we'll get to in a minute. When we see white blood cells high, which is really common, I feel like with gut issues, they could either be high or they could be low. And for this
Yeah.
one, I'll give you the optimal range because I'd be curious. If you look at your CBC, this is one that it is pretty definitive that there might be an issue. Again, if you're sick when you got your lab drawn, though, your CBC is going to be whack. Just keep that in mind.
Yeah.
With that white blood cell, they are also known as leukocytes, and they are a main part of our immune function, part of the lymphatic system, and present in various tissues all over our body because they're our body's most important defense system, right? Part of our innate immune system, the immune system we are born with. If we see them high and optimal range 5 to 7.5, that could mean that there's some sort of acute bacterial viral infection there. I find that high values are more associated with, just we've read in the research, that bacteria or the virus, where a lot of times we'll see low levels when something is more chronic. So be that a bacterial overgrowth, something viral like Lyme or EBV, a parasite, I often will see it could go one of two ways with something so inflammatory as a parasite, where immune system, both white blood cells, and if we were to do a GI map, secretory IgA are either sky high or super low. But other possibilities are just stress. Like anything in the body that causes stress is going to trigger an immune response. And a lot of times, once we have chronic stress, so a chronic infection, an autoimmune disorder, raw food diets also tank white blood cells because people think that it's good to eat raw foods, and I'm not bashing all of them. I honestly, this isn't something I know a lot about, so don't come at me. But from my research on it, like raw food diets, especially things that are like raw proteins, are just so much extra for our body to work through because one, it's usually not cooked. And that's why, like, we tell clients, if you're having issues with your digestion, cook your damn vegetables. You're making it so much harder on yourself if you're eating raw things. Imagine eating raw meat. Protein is one of the hardest things to digest as it is. So not only does your immune system have to digest that raw food, but it also probably comes in with a lot more contaminants. But I digress. That is a chat for another freaking episode. And then, Jess, you want to go through some other markers on the CMP that might show us those either B12 or folate, but B12 and folate or iron deficiency. And if we're talking anemia, this is either going to be macrocytic anemia or microcytic anemia.
I guess these are similar in terms of what they mean when they're low or high, but hemoglobin, hemoglobin and MCV, if they are low, that could mean iron deficiency. And then same with hemoglobin, when it's low, it's usually a B12 or a folate deficiency. And so when we're seeing that, I immediately just think of malabsorption. Why is it low? Your body probably just isn't digesting it properly and isn't absorbing it properly.
Yep, exactly. And this also goes back to the hypochlorhydria because you need stomach acid to absorb a good portion of your B vitamins. Or when I was studying for my RD exam, I honestly probably still have this chart because when I was studying, I made like a massive ass notes document. I honestly miss studying for that. Yeah, I digress. And there was a chart that I made where I doodled the digestive tract and wrote down all the vitamins and minerals and where they're absorbed. So, right, like a big portion of our B vitamins
Mm.
are absorbed in the stomach, but a bigger portion of especially like B12 and even like synthesis of certain vitamins and minerals is in the large intestine. So if we're having intestinal issues, be that inflammation, be that leaky gut or celiac or H. pylori or something that is damaging the intestinal walls, if we have low digestive juices, we're not absorbing our stuff. If we have low amounts of bile, we're not absorbing fat soluble vitamins. But the CBC, it really does definitively tell us, are we dealing with any sort of absorption issue? Are we dealing with an anemia? And especially you might be thinking, okay, I supplement with B vitamins, I supplement with vitamin D. Why are my levels low? That's probably an absorption issue. We're not saying you have an infection, but you might need some stomach acid support. So when talking about anemia, my favorite marker to always look at is the MCV, mean corpus volume. And this is one where the clinical range is where what you'd see on your labs, your doctor goes by, is a lot wider than what we'd look at functionally. And I remember this in the hospitals as well. I would always like flag this when I was doing clients, and the other dietitians were like, that's barely high. And I was like, it's high. But anyway, for optimal, we're looking at an MCV 80 to 90, I would say. Some people would say 80 is low, so 80 to 90, where if you have lower MCV, like Jess mentioned, you have that microcytic anemia, that iron deficiency. If it's higher, then you are more than likely having a B vitamin deficiency. And iron deficiency they're pretty common. Vegan diets, if you have heavy periods and don't eat a lot of red meat, but they're also an absorption issue because I've definitely seen clients where they're supplementing with iron or they've had to have iron infusions earlier in their life and then we fix their gut, and that's not an issue. So this like super basic panel gives us a lot. And then the last thing in here that we'll come back to would be the other white blood cells. So like neutrophils, lymphocytes, monocytes, basophils, and eosinophils. And these are my favorite thing to look at in the white blood cell panel. Again, remembering that they are going to change day to day because they respond to acute infections, right? They are so important. So the neutrophils are the first one, and they're a form of white blood cell, like I mentioned earlier, that is in our first line of defense when the body is suspecting a threat. They're more like, we think about it as a crime scene. They're the first ones to arrive on scene when experiencing, especially something like a bacterial infection. So when we see high levels of neutrophils, that is when we can suspect that there might be some sort of infection. And this is very consistent with what we see going from the serum panel, the blood work, to the GI map. Is anytime I see discrepancies in the labs that we're talking about in this episode, paired with somebody having symptoms for a period of time, will likely prompt the GI map. High neutrophils infection, bacterial, could also be more of a parasitic or fungal. When we see neutrophils low, that's also concerning because that could be related to just something that is chronic and just tapped your immune system. I feel like I don't see neutrophils low super often, but lymphocytes I definitely see low very often. So they're another type of white blood cell that protects against bacteria and viruses, and they're a different type. Lymphocytes are T cells, so they directly attack bacteria and viruses, and then B cells are going to produce antibodies that attack and destroy bacteria and viruses as well. So there are multiple types of these lymphocytes, and lymphocytes are also very heavily involved in our acquired immune responses, which we talked about in our other immune system episodes. So if you haven't listened to that, make sure you do. But with lymphocytes, a lot of times when we have infection, we see them low. And that can also be a result of other stressors on the body, like alcoholism, excess use of antibiotics or steroid medications, autoimmune disease. But low lymphocytes are a big sign that we might have an infection. On the other hand, high could also be a sign of inflammation. Monocytes are another one. Pretty much anytime I see some sort of elevation with monocytes, that makes me think that there's some sort of immune issue. Monocytes are a really cool one because they assist in removing dead or damaged tissues and cells. So they play a large role in cancer, regulation of immunity, getting things out of the body that aren't supposed to be there. Eosinophils, these are a cool one because their range is so small, right? The normal is 0 to 3%. So when we see this one elevated, that's a lot of times when we see a parasite. We had one recently where their eosinophils were super high, and we had the GI map that had the elevated eosinophils, right?
Yes, that was interesting. And you were
That
like,
was
oh, I've like never seen it like this before.
I love talking about the white blood cells. I think these are my favorite. It sounds so nerdy. Eosinophils almost always tell us that there's some sort of like allergenic response because eosinophils are that percentage part of the white blood cells that are in charge of killing things like parasites. So unlike the others, the neutrophils, the monocytes, whatever, they don't scavenge for bacteria or viruses. So this is where, especially if somebody has symptoms of a parasite, which can be a lot of different things: diarrhea, skin symptoms, dermatitis, eczema, anxiety, insomnia. We see that a lot with our parasite girls, is that we will often see that elevated eosinophil. And there's a marker in the GI map called eosinophil activation protein. They added this one recently, and I honestly don't see it elevated often. But when it is, that definitely shows us that there is some sort of histamine, mast cell, allergic-like response from the body. That's a really big one. Basophils are another one that are also related to the release of histamine and other biologically active molecules, especially related to parasites or allergy-like reactions. So thinking high histamines when we see high basophils, and that's the gist of the CBC. So again, we're looking at immune function, which shows us infection. It can also show us vitamin and mineral, and just a wealth of knowledge from a panel that literally costs me $3 to run for a client. Isn't that crazy?
So cheap. That's awesome.
And then Jess mentioned earlier cholesterol. So this is an interesting one. We could honestly do our own,
Yeah.
a lot of elevated cholesterol, or even just like high or low cholesterol, can either be a result of an absorption issue. A lot of people will think inflammation, which is completely correct. High cholesterol is usually related to inflammation in the body. However, it also can be related to a GI issue, specifically low bile production or insufficient liver detoxification. Cholesterol is great, right? We need it. It gets a really bad rep. And that's why when a lot of my clients come to me and their total cholesterol is high, I'm not really concerned. The most concerning one, in my opinion, is the triglycerides, because those are what end up accruing body fat and end up causing like and cardiovascular issues down the line. So we really want HDL to be healthy, but the others, they can signal that there is an issue with the liver. And usually that also means there's an issue with the gut. Because when we have a liver detox issue, which both of us have had, we have to think about why. So common causes, especially in relevance to the cholesterol, H. pylori is a really common one. So if somebody has H. pylori, there's usually a very inflammatory response to the liver because of its nature, and we might see that elevated cholesterol. It can also happen with fatty liver or liver congestion. Same with insulin resistance. So that's just another one that we'll look at. And cholesterol panel tells us about a lot of things outside of the gut. That's why we could just do another podcast, because it also plays a role in the production of hormones, sex hormones, thyroid, not necessarily thyroid, but seeing high cholesterol could be a sign of sluggish thyroid. But the big thing is, which we hope you get from this podcast, is you don't necessarily need to start off with a GI map if you're unsure. We can look at blood work, we can look at symptom questionnaires. And then the last one would be iron panel. Jess, you want to dive into that one?
Yeah, sure. I find iron really interesting too. So for serum iron, let's start with that one. So usually like sometimes I'll see a panel and it only has serum iron. But I think, I don't know if you agree, but like ferritin is extremely important as well, and a lot of the other ones as well. So there's serum iron. So if that's low, that's usually an indicator of iron deficiency, or again, like poor absorption of iron. In some cases, low serum iron can be an indicator of celiac or Crohn's as well. And in some, I haven't seen that in a ton of cases. But have you, Haley?
For celiac, yeah.
So
Seen a lot of
ferritin,
things with iron. Sometimes total iron is very high, but ferritin is low. And ferritin's what matters most, like you mentioned, because it's the storage form of iron.
yes.
But sometimes when we see high iron, that could be related to liver or infection or excess supplementation or not
Mm,
absorbing it into the storage form, so to speak.
okay. Interesting. Okay. And then, so ferritin, when it's low, again, depleted iron, or again, an absorption issue, or even like low intake. So we see this with low iron or low ferritin when stomach acid is low as well. For ferritin, so high ferritin could be an indicator of IBD, inflammation, or an infection. I also haven't seen that a ton. Then there's transference. So when that's high, it's usually an indicator of iron deficiency or malabsorption. And if it's low, then it's usually an indicator of anemia. Then there's total iron binding capacity. So again, if that one's high, usually iron deficiency or malabsorption. And if it's low, it's usually an indicator of anemia. So I think these, in terms of the iron panel, what you're looking for is, okay, are you poorly absorbing iron? What is your iron intake? Like a lot of my clients aren't eating enough beef, dark chocolate, iron. What's high in iron is like shellfish, things,
Yeah.
fortified foods. Yeah. And I find that it's very low. So I'm like, okay, I do using a food first approach, but then also like identifying if there's a stomach acid issue, because then there's a poor absorption issue. So yeah, what would you add to that, Haley?
We can increase our absorption of iron by pairing iron-rich foods with vitamin C-rich
Yes.
foods as well. That's often where we'll start. I honestly don't supplement with a pill form of iron very often, unless I'm pretty sure that gut health is in a good spot and that's not the root cause of it. Because for a lot of people, you can supplement with the iron, but if you're not primed to absorb it, then it's not going to do a whole lot. So what I'll usually do is obviously fix GI health first, but we'll start with just trying to increase iron naturally from their diet. That's always the approach, food first, but pairing like iron rich food with vitamin C. And I was talking to a client about this the other day, and one example that came to mind, and I need to make this for myself because it sounds so good, would be like a strawberry steak salad. If you're into having some sort of red meat, we buy ground beef and I probably eat it 2 to 3 times per week, which to me is solid. But that strawberry salad could be something because strawberries are rich in vitamin C. If you do fortified foods with iron, you're going to just want to be careful there too, because toxicity, it's a mineral. So toxicity is a thing. It's not super common, but I remember at one point everybody was talking about how cream of rice had so much fucking iron in it because it was
Yeah.
fortified. Everyone was eating it. But with iron, serum iron usually isn't enough. And serum iron, especially in the clinical range, it's a big range. So a lot of times they'll say it's normal, or it may even look normal to us, but that doesn't really tell us much if we don't have ferritin. But then that's where we need to think about how we're connecting the dots of these different panels, right? Because yes, a irregular serum iron isn't that helpful alone if we don't have ferritin. But then we can go back up to our CBC and we can check things like our CMP, like our MCV and our hemoglobin and our hematocrit and say, hey, are we having signs of that iron deficiency anemia that back up what we see in the iron panel? So that's where understanding not only how to read each panel on its own, especially as another coach or practitioner, but it's knowing how to connect the dots between different body systems, between different symptoms, even, and putting it all together. But hopefully, this gives you like a gist of how the basic blood work that you can get from your doctor. And again, if you're not sure what to ask for, definitely reach out. I'm sure we'll make a post about this when we drop this episode as well, because anything else is a bonus. This, we can get a lot accomplished and understood with this blood work. A couple others that we didn't mention, you mentioned this earlier, Jess, but CRP, that's more of an inflammatory marker. So that can
Right.
also
Right.
show us or help us confirm that there's a state of stress in the body. Also looking at specifically like vitamin B12, which a lot of people supplement with it. So even if that one to me is high, if MCV is whack, then that
Yeah.
tells us a little bit more about what the absorption is doing. Blood sugar dysregulation. Jess, I would love for you to dive into that with the connection to gut health.
Yeah, I love talking about blood sugar regulation just because we both had some issues with that. So, I think the main thing is like when your blood sugar is high all the time or you're having like these big swings, not only does it feed bacteria, so like we're thinking of SIBO here and Candida, so it feeds the bacteria, but it also increases inflammation in your body when you are going through those swings because your body's constantly trying to regulate your blood sugar. And so it can create also digestive symptoms as well. And I think there's just like this big cycle there. So it's creating that environment conducive to like growth of that harmful bacteria. Then basically that bacteria can ferment, which causes an issue as well with that bacterial overgrowth. And when your body is constantly trying to regulate these high blood sugar swings, it can alter your gut lining. So that's when we see a lot of leaky gut as well come into the picture.
For sure. Yeah. Another like symptom to consider is like food sensitivities too. A big
Yes,
thing to look out for
yes.
with food sensitivities is that CBC, especially that the eosinophils, because like we mentioned earlier, like the eosinophil activation and even the production of eosinophils in the body are very closely linked to allergens. So that's where Jess and I were talking about this before the podcast, where we started like other food sensitivity tests that people do, where there's the IgG and
Right.
IgE, and some are better than others. But a lot of times, even if you're popping up with food sensitivities or intolerances or even allergies, like I've had clients with full on like oral allergy syndrome have like recover from that and not have it anymore from fixing their
Wow.
gut. A lot of times I see that with parasites because again, parasites are the main things that are driving those eosinophils. Mold, it's also common with as well. Or I have a couple clients that are in other countries, so we didn't necessarily test, but they're having a lot of those more food intolerance like symptoms, and that's usually related to some infection driving up the eosinophil white blood cell response, causing that hypersensitivity to food allergies or even environmental allergies as well. And it can also contribute to gastritis and all of that super fun stuff. But the big thing is using this knowledge to your power. Does that make sense? This
Knowledge to your power. Yes,
power to
I think so.
knowledge. But yeah, so big thing here is if you have basic blood work and you're not sure how to interpret it, definitely don't hesitate to reach out and book a consult with us. And just because your doctor says it's normal doesn't mean that there's nothing there. One more reminder that this will change pretty much every day. So we're looking at trends. We're looking at things that we see repeated. We are looking at symptoms that have occurred over weeks and months, maybe years, to connect the dots. Blood work is just one tool that we can use. And I hope that you are a little bit more apt to schedule your annual appointment and get these labs drawn now that you know how helpful they can be. So if you have questions about this episode or really anything, don't hesitate to reach out to us on Instagram. If you liked this episode, make sure you subscribe, share it with a friend, and let us know you're listening. Thank you so much for hanging out with us.